next one is the fine arts trial, which is the role of Finerenone in heart failure with very mildly impaired or preserved ejection fraction. I have zero experience because somehow at Hinduja and Leelavati, my cardiology colleagues also are not very fond of this drug for reasons which are not known to me. But this paper in conclusion clearly shows among patients with heart failure and a mildly reduced or preserved ejection fractions, Finerenone reduced the risk of primary composite outcomes of cardiovascular death, total heart failure events, reduced total heart failure events, and improved overall health status. These findings were consistent across pre-specified subgroups, including across all LVF and of course those also on SGLT2 inhibitor. Hyperkalemia was more common, which is easily understandable. These data support the use of Finerenone in patients with heart failure with mildly reduced or preserved ejection fraction. I admit that, I haven't used this drug. So I think I request all of you to contribute to discussion on this. And I'm sure I will benefit from your discussion on this topic.
Have we got Dr. Pankaj Jariwala on board? Dr. Komal?
No, sir. He has not yet joined. Dr. Kalyan Raman, sir, is here.
Dr. Kalyan Raman, I think we can have your inputs and your ideas on Finerenone in HFpEF, the fine arts trial, the message and the promise which it delivers.
Dr. Kalyan Raman, sir? Or Dr. Nishant Tyagi, sir, is there, sir?
Dr. Tyagi, can you throw some light on this?
I have yet to use this drug. I haven't used it.
I can give some inputs. I have done a kind of we do some medical cardio talks every 1 or 2 months, and I picked up this kind of this topic, Finerenone for cardiologists, and presented a 10 minutes talk on that. And this is indeed a very fantastic molecule. So this is a non-steroidal MRA. And it gives you lesser hyperkalemia than the existing drugs, and this is a larger molecule, so it binds the receptor whole soul, and it is more selective. And other side effects of non-steroidal MRAs, which are not there with this Finerenone. And Finerenone has got very good 2 trials, is Fidelio and Figaro, and that was also kind of a twin trial. So the primary endpoints of one trial, Fidelio, was the secondary endpoint of the other trial, and the secondary endpoint of one trial was the primary endpoint of one trial. So the primary endpoint in Fidelio was cardiovascular outcome mainly, and secondary was renal endpoints, and in Figaro it was just reverse. So what both the trials and the the cumulative data from Fidelity, the Figaro and Fidelio cumulative data was published in a Fidelity data. And the pooled analysis showed a significant reduction in cardiovascular, MACE rate, and also very significant reduction in worsening of renal dysfunction. And that was, the p-value was highly significant. And this was across the patient with GFR between 25 to 90, or the patient had albuminuria. So diabetic kidney disease giving better cardiovascular outcome and a better renal outcome. So that was the idea, and a lot of nephrologists, our colleagues, they write Finerenone in diabetic kidney disease. So with this MRAs coming and giving us more benefit, it was first time in fine arts it was evaluated for heart failure with preserved ejection fraction, where we have only one drug, that is SGLT2 inhibitors, which gives us a benefit and that can modify the disease process. And thankfully, this is the second drug, in fact, which has given this hope that this can further reduce cardiovascular, endpoints and adverse events and MACE rate. And if we get more and more data, then probably we will be this will be the second drug after the SGLT2 inhibitors, Finerenone, which can be included in HFpEF patients. So this is a very, very promising trial. Dr. Kalyan Raman, you were not there. So you can also give your idea about Finerenone, in which cases you use, and what about fine arts trial, how kind of excited you are or happy you are with this results from fine arts.
Good evening, sir. We have not used any Finerenone till now. Routinely we are using HFmrEF, Orni and HGL2 inhibitors. But because of the cost, we are not using Finerenone. But definitely when the price comes down, we can use it in
It looks very promising. Looks very promising.
moderate and mild heart
Yeah,
failure.
the kind of trials which it had, basically it had 3 trials now.
Yeah.
Figaro, Fidelio, and then this is Fine Arts, and then maybe in future, I think you are very right. The logistic and the cost is one of the main factor behind this.